I started Treasure Chest Charity a few years ago when I discovered that there was long delays in the public health system for women to get breast reconstruction after a mastectomy. I'm a breast cancer survivor. I've also had a mastectomy and a reconstruction, but I was one of the lucky ones. However, there is a very low priority for women to get reconstruction in the public health system.
Breast cancer is the commonest serious malignancy in women, and in Victoria each year some 2,600 women will be diagnosed with breast cancer. With early diagnosis and better treatment, our cure rates are much better than they were, and of that 2,600 women, the number who die from the disease will be something like 400 women per year. That's still a high number, and we're working very hard to reduce that number. However, we have to focus on the quality of life of the 2,200 women who have been diagnosed and successfully treated. One of the huge advances has been we don't do very many mastectomies. Something like 70 or 80% of women can be successfully and safely treated without mastectomy, but that does leave 20 to 30% who need mastectomy. And that's what we're here about today, because after mastectomy, reconstruction can allow many of those women to more rapidly return to normal life, and it can improve the quality of their survivorship. And that's where the expertise of our plastic and reconstructive surgeons comes in.
The problem we have is that those operations are complicated, time-consuming, and require a significant amount of hospital infrastructure, hospital time, and complicated equipment. And so therefore it's not the quality of care which is the issue here, it's access to that care. These operations often take 6, 7, 8 or 9 hours, and because the amount of infrastructure is limited, it means that there's always a queue. It means that if you have a motorbike accident or a car accident, not infrequently you're going to be placed ahead of someone requesting breast reconstruction to get access to that care. As an example, some of the patients here at the Royal Melbourne have been waiting for 5, 6 or 7 years for their reconstruction. And it's not because of a fault of the Royal Women's Hospital, the Royal Melbourne's Hospital, it's a limited resource. What we're trying to do here is try to do the best we can to try and provide the very best reconstruction to patients in a more timely manner. And that's where Treasure Chest and the initiatives that we're putting forward here today make a tremendous difference.
A woman can't actually get on with her life without having her complete self, and that means having breasts, and I can't see a woman having a quality of life that she deserves after having surgery of this kind when they don't have breasts.